Well, it is 9:30, Sean. I see quite a few people on, so I think it's a great opportunity for us to get underway. And as we go along, we'll make sure we kind of pause as we see questions pop up in the chat. But before we start, I'll just say a warm good morning to all of you joining us virtually. Super excited that we have this opportunity to talk to you about all things return to work. And so just to kind of give level set for what we're going to be focused on, we're really going to spend the bulk of our time really around all things return to work. And when you think about, what that really means and how organizations are tackling their employee workforces, whether dispersed, remote, or mission critical and still going on site, what types of screening and monitoring are happening within organizations today? How are you supporting your employees through these moments when you think about mental health, when you think about their ability to not only be successful, but to thrive and flourish as they think about coming back into the workforce and office. And, the different components around readiness and where organizations are. So I'm super excited. We have the opportunity to talk with Sean Bell, who's the Chief Operations Officer at Aduro. And what I thought we could do before we got in was just a quick background about our speaker and our panelist here. So Sean, amongst the many things that you do, besides being an amazing father and a husband, I'd love to get a little background about your role and what you do with Aduro and a little bit about your background and experience in the market.
Thanks, Josh. And I'm really looking forward to this conversation. It's been so interesting to me to watch the sheer number and volume of questions we're getting in the wide range of questions around what is this, what is return to work and how does this apply? And everyone is filtering it through a lot of different perspectives. So I think it's great to get a dialogue going here and appreciate you leading us through the discussion today. Just to give a quick understanding on my background, I've actually been in the health and wellness space for a little over 20 years, have been in Seattle since 1998, have been working for quite a bit of time originally in the technology field in different industries, but really got pulled into the health and wellness industry via some close friends of mine who actually ultimately got involved with running and took over what became the nation's leading provider of tobacco cessation coaching services. We were enrolling about 1,000 people a day and doing 2,000 to 3,000 outbound interventions per day using cognitive behavioral therapy and medication support, and really got enamored in the ability and capabilities of organizations to partner with employer clients and to work with health plans and even states to really identify what was a leading driver of chronic disease, both from a cost perspective as well as from a death and mortality perspective. From there, got an opportunity to spend a couple of years working first on a research idea that became a startup at a spin out of the Institute for Systems Biology with a focus on precision medicine and personal genetics. And that was an absolutely fascinating view of how testing and diagnostics and therapeutics really can be looked at from an N of one perspective. And it turns out through all the noise, the role of coaching and engaging people to make long-term behavioral changes is still the most critical thing of all. And then last but not least, joined Aduro in July of last year to join and help the company as it's growing incredibly rapidly. And my focus here is to really focus on just the operational excellence of our organization, how to build a repeatable set of processes that really meet where our clients and our members are, and then help manage through that growth trajectory. And through that process and through what's happened with COVID, have had a chance to step in and apply that 20 years of sort of experience to say, how can we support our clients through this what everyone likes to call a black swan event, or this once in a century event. But really, it's all about how do you harness rapid change in an organization when it's being forced on you.
That's tremendous. And I think a lot of those experiences, and I'm sure you'll talk about today, have helped you kind of forge through some of these different components of return to work. So I'm excited to dig in. Well, what I'd love to do, Sean, if you're open to it, is maybe we just start off with kind of the broad strokes of what return to work actually is. So when people think about return to work, I'd love your perspective on what is it that goes into return to work? And when companies are saying, well, we're focused on it, or it's an initiative, what are you kind of hearing and thinking and seeing around that concept?
Well, it's such an interesting thing because it's such actually a loaded term. From the perspective of how an employee is thinking about return to work, versus how an employer, versus how all the many consultants and service providers out there are talking about return to work and what it means. From an employee's perspective, the very first thing that they're thinking about is, will I be safe? And there's a lot that goes into that, because when they're saying, will I be safe? What they're really touching on is not just the elements of, will I be exposed to the virus, but how will I feel? And right now, one of the things that we're picking up in just an incredible 1 in 3 of our coaching calls right now are using words like grieving, overwhelmed, anxiety, and it's all being driven by this about the fear of, we've hardwired our folks to be super thoughtful about being careful and not being exposed and not engaging closely, and now all of a sudden there's this discussion about going back into the office and how to do that, and so there's this new normal. So there's that element of return to work. Am I safe? And that's really at an employee level. That's like the primary driver. At the employer level, return to work is really like as a twofold question, or actually a threefold question. First is this question of like this legal question, which I don't want to get too much in. I'm not a lawyer, but the elements of like, what am I required to do? What do I have to do? How do I map what I want to do from a company perspective to that of which my state or my city is allowing me to do? How do I meet the needs of my customers and my clients in a way that allows me to get our company back to being productive? We're seeing just massive effects, as everyone is well aware. And then there's this third element of like, okay, well, what processes and procedures do I need to adopt, and where do I need to start, and what do I need to migrate to? On the last piece is obviously a lot of consultants and service providers have been doing nothing but sitting around thinking about this and have a little bit of a deeper perspective. And so you have these three interlinking issues around what is return to work that we're trying to find that common intersection point to say, what does phase 1 look like? What does phase 2 look like? So we've developed essentially a 5-phase model to try to map to those three elements of how an employee thinks, how an employer thinks, and then what service providers can provide and really drive people in that perspective. And for today, let's focus on 1 and 2.
No, that makes sense. Quick question, because you just mentioned a couple things that I think are really interesting. So one of the things that most certainly is showing up in the news and different publications, right, is when you think about like the different phases of what's going into this return to work process, what's interesting is, and you're seeing companies across the board that are in what I think you'd probably consider would be these different steps or phases. And you just mentioned, kind of there's a model that your organization has pulled together around these 5 key stages. And you said there's really kind of a key focus area. Would you mind maybe just walking us through a little bit of some of these initial phases and like what goes into that, and what should organizations be thinking about against those kind of initial few steps when you think return to work?
Yeah. So, I mean, right now, a big chunk of our employees and our members and the folks that we're working with and our clients are in what the first phase is, which is essentially not ready. The vast majority of the employees who are working, are not furloughed, are working from home. And what they're really looking at are resources that help them stay productive and understand how to manage what has now been, we used to talk about work-life balance and how challenging it was in today's world to map to these challenges of, hey, how do I go to work and come back and be a great parent and be a great spouse and be a great, contributing member of society and try to balance all these things. Now we've just further entangled these elements. And, how do you be a thoughtful and productive employee when you're bouncing your baby on your knee because childcare is closed and the dog's barking behind you in the middle of a client meeting, and you're trying to actually get something out that's due and try to get some sleep. So there's that first set of elements of basic survival, basic protocols and thinking. And then of course, we're dealing with this incredible challenge of how to be mentally resilient through the process. And so how do you create access points for your employees at home to have access to not just crisis care? That's really critical to the idea of how do they use their EAP, but this idea of mental resilience, at least helping them work through those challenges that we talked about. So that's sort of phase 1. We're starting to see, as states are opening, this migration towards phase 2, which we call the safe stage. How can you safely return to work? That's where things like on-site screening, thermal temperature scans, doing health surveys, and we'll talk more about that, what the right clearance protocols, and then getting the right on-site coordination. And we can spend a lot of time talking about those elements of how do you coordinate the processes and procedures. So that's phase two. Well, not many folks are there yet. Phase three, we hope will come as part and parcel of getting people feeling safe, which is feeling well, a sense of well-being, the ability to actually feel that people are somewhat back in control of their destiny and their futures. This is going to be really hard with the economy being at such and stretched so badly right now, but helping individuals at least feel well. Ultimately, and then to get them to stage four, this construct of engaged, where there's a focus on work again and a holistic well-being platform kind of, or well-being perspective ties to that, but people feel well enough to be able to really be focused and be able to be engaged in their work. And last is like where no one is going to be for a little bit of a period of time, is this idea of full, what we would call kinetic performance, that people's that their potential is actually evolving and developing. So our goal is to kind of take that 5 stages and map folks and help people map themselves to where they are, and then help them thoughtfully move through that process with the right triggers in place to know when to go from stage 1 to stage 2 to stage 3.
Right. It's interesting. The comment you made at the beginning around the not ready, kind of that phase 1. What's interesting is, right, I think a lot of organizations are still, and even at an individual level, people, right, are still in this state of, we're processing what's going on, right? We're processing what's actually happening, and we're trying to figure out, what does that look like? And what's interesting, right, is when you think about that not ready state, I'm sure there's a lot that goes into this state of, where we're just trying to figure out what normalcy is in that moment. And then the second stage you mentioned, which was phase 2, which is this safe state, right? Like we've gotten out of kind of like, we're trying to figure out how to parent and how to work and how to do all these things and support, all the things that are going on at home and at work. And then you move into the safe stage. When you think about like how you move from phase 1 to phase 2, I'd love your thoughts on what are some of the things that organizations could be thinking about as they think about the change state between phase 1 and phase 2 and phase 3, and specifically kind of on the phase 1 and phase 2. I'd love your thoughts on how do they go from one to the other.
Yeah, we've been thinking a lot about this. So I think the key thing that we've been really pressing with our clients is to avoid constructs like big bang return to work. Like there's going to be a Monday, everyone's going to return on a Monday. There's sort of two or three elements right now that we're asking people working with our clients to think about and map to. Element number one is the reality of how this pandemic, most of the science, and obviously this is evolving and we're watching this carefully, is that there's going to be, the term that's often used is the hammer and the dance. This idea that there's been this hammer, we've had this massive earthquake that shook all of us in a tremendously frightening way. And that, there's this dance element like the aftershocks where we're going to continue to see flare-ups. We're going to continue to see scenarios where, particularly in locales, where hotspots are emerging, it's still happening. What's unfortunate is that if you actually look at the data in the United States, for example, we're averaging between 25 and 30,000 new infections per day. And that's actually not dipped. Well, it's, where we've seen transmission rates drop in some locales that have been at this for weeks, and other locales it's actually on the rise. So nationally, we're still not seeing any indication that there's like a first wave and second wave. It feels like a very long plateau. And so because of that, we realize that this dance, this element of giving people the flexibility to, think about this as a hybrid model is the right way to approach this, moving from this idea of first being not ready to be moving safe, by creating an opportunity as things open up and as you have opened the capabilities for people to return to work, not thinking about having 100% of your office staff showing back up again. What we were suggesting, for example, is much as we did in kindergarten when we first got started, we didn't overwhelm students by having all the kindergartners show up on Monday, right? We had a group show up on Monday, we had a group show up on Tuesday, and have a group show up on Wednesday and Thursday to acclimate to being in this new environment. I think actually if we asked people to show up, we would create an incredible amount of anxiety and concern if people, if all of a sudden they've gone from trying to follow social distancing to now being in an office. And this also gives the local facilities and safety and the COVID coordinator perspective to actually see what works on Monday and Tuesday and then adjust accordingly in smaller groups of people. So this hybrid model is going to be first an introduction or reintroduction back in small percentages. And then our recommendation is that no matter what, there be no more than 50% of the office in at any given time. And we're not the only ones making that recommendation. So this hybrid, how do you balance and manage people working from home and people working in the office? So a lot of the specific ideas are literally like you'll have Monday Sean and Tuesday Josh, and Wednesday Heather, and we'll have a couple days a week where we're in the office and a couple days a week where we're working from home. A lot of people have actually adjusted to this, and they're much more comfortable than they used to be. But I think it's actually going to be necessary. There will be some people who will be screaming to get back into the office because family situations don't allow for them to be able to work productively. And I think each manager is going to have to evaluate that. That's step one in this process, is thinking about hybrid work models, work from home and work in the office, smaller percentage, and managing to that.
One thing that's interesting, and I'm thinking about this not only from a business perspective, but I'm thinking about it from a personal perspective, right? Which is organizations have moved so many of their employees virtually, and they're getting accustomed to that world. And so as you said, right, as these organizations are kind of thinking about that hybrid process and opening back up and getting people back into the office, one thing in my mind jumps out, and I'll speak about this at a personal level, right, is the individual angst that would come with that. And also I think about, right, so many organizations provide employee assistance programs that are designed to support people through moments like this. But there's also an inherent challenge, which is a lot of those EAP programs, as they're called, are actually they're stressed to the max, right? They're being pulled as thin as they've ever been pulled before. So I'd love your thoughts on, how maybe some thoughts and ideas around how organizations can help their employees, especially when you think about the angst tied to going back, because I don't think that there's a question that people want to go back, right? There's a want to get back to that normalcy. But I also think that there's something very real about how organizations helping their people navigate the mental component of actually that moving from phase one into the phase two. And I'd love your thoughts on how companies might be able to think about that and tackle that.
Yeah, I actually think there's two things you brought up there that we should address. One is you actually made this comment about, helping people want to return to normalcy. And I think one of the key elements and messages here that employers need to work with their employees on is actually, we're not going to return to the way it used to be. That actually is not going to happen. I don't know if it's ever going to happen, because I think this is an event that's had such a profound societal impact on so many ways. I don't think it's appropriate or fair or reasonable to tell people we're going to go back to the way it used to be. I think instead, as employers, we have an obligation and a responsibility to help our employees navigate to what the new normal is going to look like, and help them understand that we have tools, we have capabilities, as not just as human beings, but as collective organizations working together with a common goal to actually work in a synergistic way to get to that new normal. And so I think a lot of what employers are going to have to do is not just think through, EAPs are really important and play a very important role in working through what I would consider traditional behavioral health and mental health issues, all the way from, the gamut to suicidal ideation or people feeling so desperate. And clearly at a time when we're seeing such a financial stress put on the environment, on people, that is clearly there. But employers also have an opportunity right now to do two things. One is actually proactively address this anxiety collectively, rather than waiting for each individual to step in and call an EAP on their own and try to get connected and then have a few sessions and then get bumped out to a network, try to find someone in a network, a mental health care provider in a network. I think employers can actually own this, step up, and make it part of their onboarding back in. When you onboard new employees in, what do? You orient them towards the environment. You orient them towards the how to think about your culture and what's important and what do you value, and that's all part of an onboarding for new employees. We're going to have to re-onboard all of our employees again, and we're going to have to re-onboard them with a new set of rules, with a new perspective on processes and procedures, a new thinking about how we think about our customers and our clients. and bring that story to life and actually proactively lean into it and not do it on an N of one basis, but do it on a collective basis for two reasons. One is it's efficient and it's an efficient way to do things. But two is it creates that sense of we're all in this together, and that we all have an opportunity to work together in groups, whether they be the largest group, an employer, down to the smallest group being me and my teammate or me and my department, to actually figure out how we're going to do this and succeed. So that's the first element to that I think is so critical that you brought up. The second element to talk about this idea of mental health and well-being is, what's one of the spin-outs or one of the things that has become increasingly spin out opportunities that we've seen is this increase in telehealth and this increase in understanding of the incredible importance of behavioral health as an element to total employee well-being. I mean, it's something we all kind of gave short shrift, like, yeah, that's important, but I still want to measure, someone's HbA1c and their fasting blood glucose, and I want hard numbers. And that's easy to do. I can't think of a single metric right now that you wouldn't want to be focused in on is understanding the effects on the productivity and the ability for your employees to feel effective and feel that they have the mental resilience to actually be able to contribute and work. Resilience is that capability of bouncing back from hard times and being able to still move forward, to not be dismissive of that challenge, to actually embrace it and own it and get through it. And resilience is something that you can't, it's like self-esteem. You just can't put someone through a training and say, oh, now you've got resilience. People actually, it's an exercise. They have to go through hard times. They have to come out and feel that they go through those hard times with a coach or a trainer or somebody who's going to help them understand how to put that challenge into context and learn and grow from it. And now employers are going to have to lean in, and human resources organizations and people and culture are going to have to lean in to say, our next area isn't just dealing with the physicality of this, but it's actually dealing with the psychological burden that our employees are dealing with, reorient them and get them focused on a new trajectory, all while doing that in a way of helping them be safe physically, because that's a prerequisite to feeling, mentally well enough to be able to contribute. And obviously we should talk a little bit about the physicality of that, but I've talked a lot at you, so I'll pause and see if there's anything you want to follow up on that.
Yeah. You bring up a really interesting comment around, that resilience is an exercise, and I think about, I always try to think about things in the terms of how I would actually go through it, or a family member or a loved one or someone I know, right? And like what they're kind of navigating right now. And one of the things I always think about is my mind goes to in this conversation around resilience as an exercise is resilience is really tied to an overarching, a well-being philosophy, right? That organizations are still trying to think through. And you got me thinking as you talked about it as a couple parts, right? So one is you talked about there's going to need to be this new process. And then you talked about how behavioral health is really, kind of come back up to the top of the dialogue box, right? It's, organizations are talking about it now in a very real and tangible way. And I'd love your thoughts on, how does this, as you think about right now, this moment of, call it your phase one moving into phase two, which is you're moving from not ready into this safe phase. And you're talking about a couple different pieces of an overarching, a well-being strategy. I would love your thoughts on how does a company's ability to support their people right now, the immediacy of now, actually stitch into a broader well-being strategy? Because I think that there's a lot of questions on, we're trying to solve one particular part of a problem, but we don't want it to just float there. So I'd welcome your thoughts on how do you actually take this particular moment in time and actually pull it into a much broader long-term strategy, which I think goes to your comment on there's going to be a new normal. And there's going to be this need to have an onboarding process. So I think there's a really great opportunity to kind of stitch it together. So I'd love your thoughts on that.
Yeah, and I'm going to actually take this in a slightly different direction to start, and then come back to that, only because I think I think there's an element of this not ready to safe that we really do need to address first and foremost, and then it'll fit into, I think, the conversation on well-being. So what is so interesting about where well-being needs to, there's this really crazy thing that's happening right now, which I call it the collision between OSHA and HIPAA. which is, probably a bad term in a lot of ways. But, well-being programs, for the most part, were really focused in on markers of sort of an individual person's chronic health, chronic disease in particular. Diabetes risk, cardiovascular risk were the two big drivers. And then there were other elements to it, like exercise and nutrition, basically both feeders into how do I avoid my employees getting chronic diseases with the ensuing costs associated with claims, for which there was always a challenge to tie those two together, because frankly, how we price healthcare in the United States and how we manage healthcare risk are so totally divorced from each other that those measurements were always painful or impossible. And so we always saw this challenge, like, okay, well, but that's really where it was a very sort of encapsulated element. And then, companies, not to toot Aduro's horn too much, but, companies like Aduro did try to have expanded that perspective out to be like, well, there's multiple dimensions to well-being. You got to think about, like financial well-being. You have to think about your growth and development. You have to think about your contribution to society, and how, those are all elements of how people think about things. And so we've created this model around 6 dimensions to well-being, and that's played very well. 50% of our members don't come in for traditional well-being things like nutrition and activity. They actually come in for, I actually need to know how to create a financial budget, or, I'm struggling as a parent, or I have a parent I'm trying to take care of, and I'm completely anxious and stressed over that burden. So very different. But yeah, that's sort of this next element of how people sort of evolved this well-being. But now all of a sudden we have this element of OSHA, which is like employees' actual physical safety. Now, there were people who were doing things like, okay, as part of my well-being program, let's make sure we're showing people how to lift boxes correctly and think about that. But now all of a sudden, en masse, it doesn't matter if you're white collar or you're blue collar. Now there's this process on, okay, first and foremost, how do I keep my people safe? How do I actually physically ensure or help ensure that I'm doing the best I can to minimize the potential for my company to become a hotspot? We've all seen the horror stories on food processing organizations that, based on the nature of the design of their actual companies, hundreds of people are getting exposed and developing the condition or developing COVID because of that. And it's had a massive impact on the potential for our food production. Very scary to all of us, right? And so, we're seeing these changes happening right now. So the first element is how do you keep your people safe? And so the things that we're working with our employees on aren't just thinking through things like screening. That's an important element of how our members are trying to at least do symptom checking. But quickly that's starting to evolve to how do people do symptom checking at home so they don't show up into the office with illness? How is that going to be done in a scalable way? What are the privacy issues associated with that? I did get a question that popped up on contact tracing, and we will talk about, I want to make sure we touch on that for a few minutes as a question, because I'm sure employers are trying to figure that out. But first and foremost is getting the right COVID-19 resource coordinator, a dedicated person working with facilities, with operations, with human resources and legal to actually map out this actual physicality of getting people safely into and getting customers safely into a workplace. And, it's not just the 50% rule. It's going to be thinking through things like bathroom usage, kitchen and meal usage, the layout of your hallways. How many people will you allow in a conference room at a given time? How will you do both virtual and real, given the fact that you're going to manage 50% all the time? So you just can't be like, hey, if you're virtual, you're not going to hear this meeting. So there's all these sort of rolling elements of the physicality of the actual footprint of the organization that's played out. That's sort of the big phase 1 chunk of it, but it really is this elements of safety and employee privacy and health all kind of coming together now in a much more profound way than we used to think about it. And then the last piece I'll add to it is, well-being programs that have not given or have given short shrift, to this idea of behavioral health are going to struggle in the future around this, because these things are so now intertwined in the needs of employee populations. Separating them out into different benefits is going to be a real challenge. The entire industry around behavioral health and mental health is so silly, because what we've actually done is we've literally physically siloed it from a network perspective, from a management perspective, from a dollar spend perspective. And there's very little interaction between how an employer's well-being program and their EAP interact. In fact, they don't really. I mean, it's usually just a one-way trip over to the EAP when you've breached a certain set of criteria and well-being, and all of a sudden we think you need the EAP and you want to make sure your well-being vendor can, get a warm transfer. But that's not at all how people are going to be dealing with this. We're going to have a number of people dealing with profound behavioral and mental health challenges over the next year to 2 years, adapting to the new normal, dealing with grief about loss, dealing with new stressors, financial stressors and emotional stressors and family stressors they've never had to deal with before. Laying that on the hands of like well-being is going to measure your waist circumference and provide you some, light content on how to eat kale and how to cook it right, versus, oh, now, go over to behavioral health and we'll actually start talking to you about your stress and anxiety, is going to be a wasted opportunity. So we're laying out those two paradigms right now, the physicality element of it, the actual processes for safety, and then that element of like adapting the well-being program. We use the 6 dimensions. It's a good framework, but there's other approaches and other models out there that are equally good.
No, that makes a ton of sense. And, it's interesting too. And a couple of the questions that have already started to trickle in right around kind of how do you stitch it together? And I appreciate the way you talked about it, right? Which is there's most certainly phasing to it, but it's also the ability to really look at it differently, right? And how we've historically, how the market has kind of just, as you said, divorced these two concepts, and how really what you're seeing is it's actually where success is bringing those two things back together and allowing organizations to meet them now and long term. One of the things I wanted to pivot to for a few moments was, the one thing that we hear so much about, right, is as states and as the federal government, states, and even down to the organizational level are tackling the basics around return to work. So when I think about the basics, right, you hear so much about COVID screenings, rapid tests. You hear about antibody testing. I've been reading about the need for thermometers and testing your employees. I'd love your thoughts as organizations are kind of tackling kind of this phase 1 into phase 2 and what they're offering. What are some of the things that organizations should be considering? And as they think about, where they're at today versus all of these different offerings and solutions that are coming online behind it, like how do they sift through that? Where should they start? What makes the most sense? And what's kind of, what are you seeing it evolve into? I'd love your thoughts on that.
Yeah, that's a really, it's a complicated question because so much of this is going to be dependent on both the state, the locale, and your company's culture around this. So I'm going to try to give for the purposes of this, to give a general answer, just to kind of broadly give broad strokes, and then happy to do deep dive in areas. First of all, the company culture is one of the first elements to all of this, is being very, very upfront with what you're doing and why. I think one of the things, for example, obviously there's a lot of, you have to always be careful with media because, the model is based on clicks. And so, you want to create a sense of outrage and fear. But we are seeing locales struggling with the very elements of like, what is appropriate social distancing? Is it reasonable to ask a customer to wear a mask in your facility or a client? There's all sorts of, questions about, my individual rights versus our collective responsibilities. Those are all societal debates that are reasonable, but those societal debates are actually going to get played out in the culture of each company too. And employers have to think through these things in pretty specific senses and rethink these elements. Like if we have a norm that we've defined as what our new norm is to provide protection. First and foremost, have we really communicated why we're doing what we're doing? Like when we, for example, are going to send someone home who has a symptom, and that symptom is correlated with COVID, but we don't know exactly whether or not we have that. But we send someone home and they can't work. And if they can't get a test, we have to tell them to isolate for a certain number of days. How's that going to get transmitted in the organization? How is the organization going to respond in a way that individual feels not ostracized and treated poorly, because then what you're going to have is people lying. There'll be a negative bias towards reporting symptoms for fear of, being put into a scenario. But at the same time, how do the employees at work feel about these scenarios? And so being super clear about what your process and procedure is, and and more importantly, why are you doing it the way you're doing it, is step one in this process. Step two in this process is being consistent. So one of the elements that we've heard, one of the questions we've gotten is, well, once an employee's had COVID and presumably have the antibodies, can't they just come back to work and just do things as normal? And our recommendation is A, the science on that's still unclear. We don't really know how, like, the length and the amount of antibodies you need and the type of antibodies you need, and the science, and I'll talk about antibody testing in a second related to that. But nonetheless, like, you don't want to keep classes in your organization of people who are following the rules and people who don't need to follow the rules, because I don't know why this person's not doing it. Are they just being non-compliant, or have they had COVID and they're fine? I don't know that as a person. And frankly, I don't want to necessarily have employees try to self-navigate through that. So our recommendation is that every employee in the organization, regardless of their status, who, if they're in there and they're in the workplace, follow the same exact set of procedures. If everyone's going to wear gloves and a mask in the kitchen area, everyone wears gloves and masks in the kitchen area, period. From the CEO on down. There is no difference whatsoever in how anyone needs to think about that. If everyone needs to walk in one direction, or if you only are going to keep 4 people max into a conference room and they have to be spread 6 feet out, the CEO and the C-level team don't get to have a meeting with 6 people in a room. It sends the wrong message, and it gets people really, really confused about, well, wait, what am I supposed to be doing here? So one is being super transparent. 2 is being completely consistent in how you follow those procedures. And then 3 is getting things laid out in a way that are simple and replicable and easy to do with assistance. One of the key tools that I'm actually been recommending to clients is to there's a great book, Atul Gawande is an author. He's a surgeon who's well known for a book called The Checklist Manifesto, amongst other books. And the Checklist Manifesto, everyone always confuses it as a book about how to write checklists. It is absolutely not at all about that. It is about how complex, super complex procedures, our brains cognitively over time start to miss spots in procedures if you don't actually have a simple way of making sure you're following the procedure every time. This is why every time, it doesn't matter if you're a 30-year vet or a 3-month newly trained captain, when you get into the cockpit of a plane, you follow a written set of procedures religiously, one after the other. And there's only 3 to 4 procedures per page, not 10, because people start to skip over it. So this process of creating replicable processes, having the capabilities for people to understand what you're doing and why, having that process laid out in a way where, for example, step 1 in your process might be, we're going to start with screenings, because we don't have the capability yet to have people remotely check from home. And we just want to make sure we're doing our best. So there's a few questions you need to have answered. They need to be screened for fever. They need to be visually marked as having been screened for the day so they can go in and out. And that needs to be done consistently for everyone. Everyone needs to go through that process. And that's the first step, and the very first step on that. And then we'll migrate them through the next step, which would be, okay, can people do these tests at home? Yes. So we develop a mobile experience. We have people self-attest to their thermometer, or we provide them with thermometers, have them do that measurement at home. That's the next phase on getting them to do that. And then the third phase after that would be moving into as we get broader access to testing. And I'll just quickly touch on testing since you asked. There's 2 types of testing that are available. There's antibody testing, and there's what's called PCR testing, which is a test that tests for essentially the RNA, the genetic elements of the virus. Here's what we know right now. Here's the best science as of today. This is changing in real time. Antibody tests so far, for the most part, have been deemed to be very, very unreliable. There are a couple tests that are under high levels of scrutiny right now that are showing good results, but measuring the antibodies right now it's hard to measure antibodies well. And right now, the tests that are out there are not, they're getting false negatives or false positives 30, 40, 50, even 60% of the time, completely useless. If I were an employer right now, I would not rely on an employee's antibody test. I just would not do it. I would still have them follow the same procedures. Now that's going to evolve. Like right now, as I said, there's a new test out right now that's quite good, that is being looked at. That is a blood test. You pull blood and you ship it to a centralized lab. It's spun out and it's measured. You can get results in a few days. Seems to be pretty reliable. University of Washington Virology Lab has done a series of tests on it. These antibody tests will improve, but that is how we're looking at antibodies right now. As it relates to the PCR virus tests, our recommendation to employers is to not do those tests on site. If you think someone's been exposed because A, they have a symptom, or B, they think they've been exposed to a family member, you don't want to keep them on site to be tested for two reasons. Your company is not designed to be a medical organization. I mean, unless you are a medical organization.
Right.
We've got health system clients. This doesn't apply to them. If you're a manufacturer, your room doesn't have a negative vacuum. Like there's just some basic elements of how to keep the room sterile, how to professionally have it clean, that you should not be doing on site. If someone has a symptom or if someone admits they've been exposed, they should be sent home as quickly as possible and sent to a centralized lab to get an accurate test. There are some home test kits right now. LabCorp just released one. I've not seen any data yet on its what we would call sensitivity and specificity. So I don't know about that. Right now, the gold standard is still that very, very uncomfortable two-test model, a pharyngeal test and a nasopharyngeal test that feels like your brain's getting scraped. But those right now are more accurate. They're getting a better read of virus, a viral load. So if I was setting this up, I would have the screening done and symptom testing. Phase 2 would be doing remote symptom testing, having people do it every 24 hours from their house via a mobile app. And then third phase would be the ability for them, if they think they've been exposed or they have a symptom, go get a virus test. They get a response fairly quickly, and then we'll be able to watch that evolve. Antibody testing, I'm putting on the back burner until I see better science.
Yeah. And that makes a lot of sense, right? One of the things that you're seeing a lot of, right, is at the state level where they are doing those tests, right? They set up these very specific facilities to do it. And so my mind would go to, how would an organization do that? You mentioned something that was, I just wanted to hover on for a moment, this idea of testing at home and how, organizations would want to lean in on that. And you made two important comments, I thought. One was you made a comment around when you think about the consistency and that you want a consistent process. Are you seeing organizations and a lot of the work that's going on within Aduro, are you seeing organizations want to just test those mission critical employees? Or are you actually starting to see a migration where they're saying, you know what, this needs to be available to everybody. And we need, whether they're at home or they're in the office, we just need to make it available to them. And I was just curious, what are you seeing around kind of the want and need around that scale for the testing at home piece?
Well, there's sort of been three phases to how this has been laying out with employers. Phase 1 was complete deer in headlights. Everybody was scrambling to get the most basic information. We were getting inbound requests for all sorts of questions, like, should I be setting up testing facilities? And that evolved to quickly like, okay, that's not realistic. So, hey, we just want to test our mission critical essential workers. And we're going to do that, for, a couple of weeks. Now that's actually evolving, and we're getting dozens of requests. I mean, literally, when I say dozens, I mean dozens requests for proposals right now for longer term modeling, where we would be providing some level of screening to begin with on site. We've already announced we'll have a mobile app out in the next 2 to 3 weeks that will allow people to do most symptom checking from home. That's going to evolve as well. And so now we're taking people on a continuum to, okay, basic information to essential worker to now like, okay, this is going to be the new norm for the next weeks, months, hopefully not years, but definitely months. And now we're going to have to figure out how we're going to do this across the board, because we don't want one group of employees saying, why am I getting tested and this other group of employees isn't? That could open up legal questions. Once again, I'm not a lawyer. I'm just saying, right, as a chief operating officer, I would be asking my lawyers those questions. what's the level of burden we're putting on one employee versus another, particularly if we're sending them home.
Mm-hmm.
And so being consistent in that policy, thinking through ways to do this cost efficiently and effectively is the right step. We have had employers say, well, can you just train my employees on how to do this testing? And that's a fair and reasonable discussion. Our answer is an honest one right now. No one's had to do this before. It's not like, Aduro or any other provider out there was like, oh yeah, sure, we've done infectious disease control testing at scale for thousands of people for months. So sure, here's the book.
Right.
It's all moving in real time. And so what we've told our clients is, yeah, we would love to evolve to that, because we don't think in the long run, even with the large network we have of screeners, that we think we could keep up with every employer in the United States going to this new protocol. But we're not there yet. I can't tell you what the best practice is. I can only tell you what practice we're starting with and what we're learning in real time. So we want to take that through a few cycles and then sort of take a step back and say, hey, we've done this safely. We've done this with a low incident rate. We're feeling confident. And now we feel like we can bundle this up in a way where we could say to everybody, look, here's the open source version of how to actually effectively manage an organization to keep incident rates low, keep productivity high, keep people's mental health and well-being good, and actually do that and bring that. And we're right now writing an ebook to capture the first phase of this. I'm expecting this is going to have additions to it, because we'll have first edition, second edition as we learn. The ebook will cover a lot of this sort of 5 stages up through the model, with some specific use cases. I think we'll bring that story to life. Just quickly, because I don't want to give short shrift to this, is we've gotten a few questions about contact tracing.
Yeah.
I just want to touch on that because it actually relates. So this is an area, once again, where I know there's going to be a very interesting collision between safety and privacy. Let me tell you how companies are looking at it now, and what we've seen in the space, and how we think it could migrate. So let's take a step back and separate out, just for the purposes of this discussion, the needs of a public health initiative, like tracking contact tracing within the community, versus the needs of an employer, which is related to that broader public health question, that issue of community health, but also has a layer of, how do I ensure that my company doesn't become a hotspot? I mean, I think it's a pretty critical question. It's one thing, like, you could very well have a scenario where the locale actually has a very, very low incident rate, but right, somehow, for some reason, your company has become a hotspot. And that may not rise to the incident rate that gets the whole, locale worked up. But if you have to close your office again for days or weeks and do a deep cleaning and jerk everybody back into their home, you want to have as early an understanding as possible so you can adjust your operations accordingly. So what we've tried to do is to say all employers have a huge responsibility to contribute to the health of their communities by being proactive, engaged members of that communal effort to both track this disease, isolate it when it happens, and provide people with a fair and reasonable methodology to be able to stay isolated and not put themselves into dire straits. But in addition to that, employers are going to deal with the additional burden of, how do I make sure I can actually keep my local offices functional? Mm-hmm. So this contact tracing thing is going to be a big question. Right now, most of the contact tracing discussions have actually focused on the community level. And there's been the primary methodology that's being used right now is being developed out of Google and Apple. And it actually uses a decentralized approach to actually try to protect the privacy of individuals. And so, without getting too tech geeky on this, what they're modeling right now is a Bluetooth element where each phone that has the Bluetooth, this enabled on their Bluetooth, will have essentially a 20-digit hash associated with the phone that will change every 20 minutes. So no person's hash will be stored centrally for long. And that hash will, in essence, in a decentralized way, say, hey, Sean's phone and Josh's phone were this close to each other for this period of time. Mm-hmm. And that's going to go and be stored on our phones. And then if Josh goes in and updates his status to say, hey, I'm COVID positive, everybody within the last 7 days that your hash and my hash actually engaged each other at a certain level of distance and duration as measured would be notified. So that's the way they're trying to manage the privacy element, is to actually not have everyone's data stored in a central server. Makes good sense. But there's two elements to this thing that actually are going to put a challenge on it. Challenge number one is phase one of this is not built into the operating systems of the phone. It's an opt-in on your Bluetooth. But each public health authority, so let's just say the Department of Health in Washington State, is actually going to have to build its own mobile app that uses that technology. No private company is going to be allowed to do this, by the way. This is only going to be done at public health. You know, Aduro couldn't build an app and go put it on the App Store and say, this uses the Apple and Google APIs. They're not going to allow that to happen. But then Sean Bell, live in Seattle. I need to actually know to download my app from Washington State. Then I need to go in and opt in to allow the Bluetooth to talk to it. Then I have to update my Washington app if I've been exposed. And then the notification will go out to everybody. Assuming you have an app on your phone, Josh, that allows you to do that.
Right.
In phase two, they're going to build it into the operating systems. So then that's months away. So then you don't need an app, because then the phone's native operating systems could actually send out notifications that would pop up as a notification without an app. But the issue we're running into right now in this contact tracing is that if you look at a highly, highly communal country like Norway, right now they're using a countrywide contact tracing app, or Singapore, for example. And right now, I believe the max download they're having is like 30% of their app. It's just too low. So I don't think employers are going to be able to rely on that in the next year or two. I think they're going to have to come up with a contact tracing strategy on their own. Aduro's actually thinking about how its mobile app can do that in a way that protects privacy of the employees, but actually allows an employer to be notified of whether or not a hotspot. We've not cracked this answer yet. But that's actually like a fast follow to the mobile app experience we're thinking through, because we do believe at the employer level, it's going to be critical to actually have a signal to say, shoot, we've hit a certain number of people that are now symptomatic via the symptom checker or what they're sharing. I could go on about this, because actually from a health perspective, it gets really interesting about the period of time people asymptomatically shed virus. But that's for another discussion when someone really wants to geek out.
No, that's amazing. And I think, what gives us I think where I get, and I'll speak for myself, right? Where I get excited is the ability where it's embedded, where you don't have to think about it, right? And so, whether you're at an individual level or at a corporate level, right, is that the infrastructure is there so that we were able to manage through those moments, as you said, those hotspots that pop up. And I'm just noticing the time. What I felt we could do maybe in closing before we answer any more questions is, I would love for you to maybe give the broader group just a few simple steps that you think today would just be helpful as they walk away from our time together, around just tackling some of maybe those initial few steps as you think about kind of the 5 that you've outlined. So when you think about phase 1 and moving into phase 2 and even phase 3, right, feeling well. I'd love your thoughts on just maybe a couple of things that organizations could start thinking about over the next couple of weeks that they could bring online for their population.
Yeah, so I think first thing right now is if you're a fan of hip hop, there's a term, you can't be a part-time gangster. You cannot be a part-time COVID resource coordinator. Like this is for the next several months is going to be a full-time job for somebody to manage in your organization. I wish I could say it's not going to be, but it is. And so having one person dedicated to acting as the coordinator in the organization, whether you go ask one of your vendors to do that for you, or whether or not you're going to do that with your own person, having one person who are just focused on this, because you are going to have to have coordinated the facilities and safety of your organization, working in real time with the operations of your organization, particularly if you're like this is where it gets really complicated. It's easy peasy to say like, hey, we're a tech company and it's mostly software developers, and we don't frankly care if you show up at noon and work to 8 p.m. or show up at 6 a.m. and work to 5 p.m. I don't, like you work the way you want to work. You want to work from home today? Work from home today. If you're a manufacturing organization and you have to have people on the floor to build in order for you to produce, having the timing of your operations rethought through so you could effectively avoid clustering at doors by having people waiting to get measured, a huge issue. So first part of this is really having someone who can coordinate between operations, legal, human resources, and safety and facilities. The next thing is to start walking through step by step when you're legally going to be able to open up. For example, in Washington State, we think realistically, if we hit our benchmarks, it'll be late May, early June. So if and when a Duro starts opening its doors, as I said, we're going to start by doing that with a staggered approach, certain percentage of people coming in on a day-by-day basis in the beginning. People will be assigned days that they can come in, probably 2 to 3 days at max, probably closer to 2, 3 days at home, 2 days at in the office, keeping that to a minimum, and then using that to learn. Like what we're doing right now is we are literally going in, a couple folks are going in with masks right now and are physically starting to do layout and markup. For example, we're not going to allow any more than 2 people in any conference room with the exception of one large conference room we have that could hold 20. It's not going to be allowed to have more than 8. Everybody's getting their own dry erase markers. You can, as someone said, you'll get to put whatever bling you want on them. Keep them and bring them into your own meetings. We're going to actually likely move towards actually having people like, how you schedule a conference room, you're going to schedule time in the kitchen. You schedule a 10-minute slot to show up with a mask on. There'll be gloves there. You can make your food, and you're going to go sit down and eat somewhere. You're going to socially distance while you eat. You're not going to be able to sit in close proximity to each other. We're going to ensure that people are sitting in cubicles every other cubicle. So this is how to think a little bit about, those are the very first steps, is getting someone coordinated, thinking about physical layout of your organization. And the last is, once you've actually known how people are going to be able to circulate in the org, then actually figuring out how you're going to get them into the org. And that's where the elements of how are you going to do symptom checking? And you need to consistently do symptom checking every 24 hours. I know this feels like a huge burden, even psychologically, ask our employees to do, but we're going to have to do that for at least for the next several months. The virus moves too quickly. There's too many slippage points where people could fall. You're fine today, you're not fine tomorrow. That's one of the downsides of virus testing. I do my virus test today, I get a response, I'm great. 2 days later, I get exposed by a family member who was asymptomatic, but I think I'm in the clear. So there's going to have to be a process for consistently checking people, not consistently testing every day, but consistently at least asking for symptoms. And then how are you going to physically allow your customers in? What is going to be the culture you're going to establish? And that's the fourth thing I'll say. You have to establish, I talked about this culture of consistency, of open communication about why. I think it's going to be just as important to explain to your customers, why are you doing what you're doing? And what are your procedures if someone chooses, either an employee or a customer, chooses to be non-compliant with why you're doing? You have to think through those pieces. So those are the 4 things I would say right off the bat, everybody should be working on. Getting people ready to measure symptoms, figuring out the physical layout, getting the screening, like how are you going to get people in, and thinking about the culture and along that line. And in that first phase, we talked a lot about not just getting people ready to physically show up, but getting them psychologically and mentally ready to show up. And that means all those elements of mental resilience that we talked about in the beginning. So I hope that was useful. And that
was great.
That's all. Yeah.
No, that was tremendous. So I know the questions that had been coming throughout. I looked in the chat thread, and actually we tackled quite a few of them through your responses. So that was tremendous. So if you notice on the screen, for those of you that have joined for the SHRM credit, you can make sure you capture the code at the bottom under the activity ID. And in the last minute, I just wanted to say, first and foremost, Sean, thank you for taking time out of your day. This was unbelievable. I have pages of notes while you were talking and just things to be thinking through. And more importantly, it also, I think, just really talks about, right, you said it on multiple occasions, which is, this is ever changing, right? This continues to have an ebb and a flow to it. And I think you made a number of just really, really great comments around it's not necessarily linear and different things to think about. And last but not least is for all of you joining online, I think that, if you were able to get even just a couple nuggets today, we're excited for you and your organization as you start to tackle and move through the return to work focus and initiative. If you have any other questions, please don't hesitate to reach out to us at Aduro Life. But I just wanted to say thank you again for everyone that joined us today. Thank you again, Sean, for taking time to do this. And we wish you all health and well over the week ahead. And we'll look forward to talking with you in our next series. So thanks again, Sean.
Thanks, everyone. Take care.
Take care. Bye-bye.